Hello. I said this is MyComrade PPI partnership, and we're presenting our collaboration with the MyComrade study. I'm a proxy for Nan, who will introduce and provide a short description of the MyComrade study itself. The MyComrade study is a cross-border study between Northern Ireland and the Republic of Ireland. It's a pilot cluster randomised controlled trial and examines the effect of an intervention that supports GPs and practice-based pharmacists in the review and the management of multiple medications prescribed to patients with multiple morbidities. The core aim of our PPI partnership with the MyComrade study is to ensure that the perspectives of persons living with multiple morbidities and polypharmacy were heard and reflected in the development and the dissemination of the MyComrade study. Nan could not be here today, so I'm acting as her proxy. And Nan has given a personal note which states that she has been fighting with multiple morbidities and polypharmacy since September 1998. During this time, she has endured many negative experiences during hospital admissions, outpatient clinic attendance, and also GP visits. She has found that there's been much negligence, from miscommunications to misinformation to even the disappearance of her hospital file. While this research study is concerned with GP medication review, first-hand experience and insight into living with multiple morbidities and polypharmacy made MyComrade study very relevant for her. She felt that this MyComrade PPI partnership was extremely important to her, and it has given her a voice that she would otherwise not have been heard. She feels very privileged to be part of the MyComrade study and to be in partnership with the other team members, and finds that the research team themselves were professional, was relatable, and consequently was easy to work with. I would now like to hand over to Dr. Maurice Brown, who's next to take his part. Maurice.
Okay. Hi, my name is Dr. Maurice Brown, and I wish to describe our PPI partnership with the MyComrade Plus study. I have been a GP for over 20 years, and after leaving my practice in Castlederg, I worked as medical advisor at the Western Health and Social Services Board for 15 years, where I was responsible for primary care throughout the area, including GP prescribing. These two occupations give me a knowledge and background into research, and I was interested in being involved in the MyComrade Plus study and keen to help in any way I could. In addition, I am living with multiple long-term medical conditions, and I'm taking more than 10 medications per day. My initial contact in late 2019 with Colette Kerwin, the MyComrade Plus Research Associate, was initiated through John McCusker, Secretary of the Rotary Club of Strabane-Lifford, who later also became a member of the group. The club has members from both sides of the border. After discussion at a club meeting, it was agreed that I, Dr. Maurice Brown, would be the best person in the club to take this forward. I first met with Colette in Lifford on the 16th of January 2020, and she explained the details of the study and the part a PPI partnership would play in the study. I then, with Colette's assistance, managed to get a group of four established. Our 4 members, 2 female, Nan and Katie, and 2 males, John and myself, as cross-border representatives, have substantial experience of life, have direct or indirect contact, exposure, or experience to living with multiple long-term health conditions and prescribed multiple medications. A second face-to-face meeting with two members of the panel partnership took place in Lifford at the end of February 2020. But the first meeting of our full member group, planned for the 18th of March 2020, infamously coincided with the initial COVID lockdown. This meeting and all subsequent meetings were conducted virtually via Zoom, and communication between the researchers and the PPI partnership was by email. This means of communication proved to be very successful and allowed us together to accomplish a great deal in a short period of time, as you will hear shortly from Katie, who will follow me. Involvement with MyComrade Plus study so far has been a great experience for me. I have found it very interesting and have been able to increase my knowledge of modern research techniques. Since March 2020, I have been unable to socialize face-to-face in the normal way, but our frequent Zoom meetings with our group of knowledgeable, pleasant, and respectful members have gone some way to filling this gap. Thank you, and I now hand over to Katie.
Hello, my name is Katie Baxter. I've worked in a number of roles in a GP practice in Northern Ireland for 40 years. And most recently, prior to my retirement, I was practice and finance manager. When invited to take part in this MyComrade Plus PPI group, I was very interested, especially as I felt my work experience had a relevance to the area of the study, an area which has a potential for improvement of patient care. The group focused on 3 areas: the interview invitation letter for patient participants, interview questions, and developing a code framework for the interview responses. With the interview invite letter, the group commented and changed some of the wording to clarify the interview process, to alleviate any potential anxiety and encourage positive response from participants. GP details were also included to enable participants to inquire of their GP for further reassurance. Interview questions were discussed, and prioritizing and sequencing suggested also simplification of wording for some questions and exclusion of questions thought to be irrelevant. It was also thought, because of the pandemic, that some questions on the impact COVID-19 has had on patient care should be included. All suggestions from the group were taken up by the research team, Lisa and Colette, and implemented. The final input of the group has been the developing of a code framework for the interviews. For the group, this involved coding an interview with descriptive codes. This process was new to all members of the group, and therefore we relied greatly on Lisa and Colette for guidance. I have benefited from participating in the PPI group, and particularly during the COVID-19 lockdown periods. This study has been interesting, purposeful, and enjoyable. Now I'll hand over to John, who will tell you about some of the challenges that we had as members of the PPI group. Thank you.
Thank you very much, Katie. My name is John McCosker. I'm a person passionate about giving service to the community. I spent many years as a member of the Strabane District Roundtable and subsequently becoming a member of the Rotary Club of Strabane Lifford, of which I'm still a member. The ethos of both of these service organisations is somewhat similar and the motto of Rotary is service above self. After getting a telephone call from Colette Kirwan seeking assistance from the MyComrade study, I couldn't resist, but being unsure of the study, I mentioned it to my fellow Rotarian and close friend, Dr. Maurice Brown, who had a professional medical background. Maurice followed up consultations with Colette and then brought it to our Rotary Club, where it was embraced as a project. Eventually, he set about forming a group to assist Colette, recruiting me in the process. It has been a pleasure for me not only to carry out the exercises for the purpose of the study, but also meeting, getting to know, and working with the other members of the team. This association has been one of the great strengths of our endeavours. Contributing to the research and exercise of the study was encouraged by my own personal health problems and my experience of the relationship between general practitioners, consultants, and conflict between consultants. This gave me the realization there could be better explanation of diagnosis and treatment. In my case, I had to engage in self-management of my condition and objective interpretation of comments from GPs and consultants. My experience exposed a patient's need for clearer understanding of medical conditions and explanations of treatment and medication by GPs and consultants. I served as a member of the Department of Health and Social Services Appeals Tribunals for 10 years, dealing with a variety of social claims. I served 8 years on the board of the Northern Ireland Fire Authority, which was instrumental in bringing in new and policy and procedure regulations dealing with recruitment, staffing, personnel deployment, appeal and discipline tribunals. Associated with all of this was comprehensive training on all aspects of service so as to be equipped to sit on all the respective panels. Experiences equipping me with valuable, impartial and objective skills. Being involved in any study for the first time is daunting. Me, for example, I'm very practically minded and need purpose and strategy clearly defined. The purpose became clear as we proceeded with the study, and from this our strategy for engaging emerged. The coding of the interviews for the MyComrade study required the use of skills such as focus, interpretation and concentration. Using these in such specific circumstances had its challenges. Additionally, the need to remain objective and confine interpretation to the sentiments expressed by patients in their interview was especially challenging. However, we took these challenges on board and from feedback from the research team accomplished it very well. Working remotely due to COVID presented its own set of challenges, such as not having consultative opportunities to ensure staying on the right track, but these eased over time. A personal strength for me was achieving the tasks set for the group that was within the realization of what was expected. As this progressed, our confidence increased. Being able to collaborate with a group during Zoom meetings, tricky, but now our new norm. Being part of a team that had mutual respect for each other, where no member was dominant, was a great strength to the team, and this enabled full inclusivity. Support, assistance, and leadership from the MyComrade research team was invaluable. The personal and occupational background experiences of each member and its variance was of great benefit and relevance to the workings of the group with the subject matter of the study. To conclude, I would like to say on behalf of the group, it has been a pleasure to work on this study. No new endeavour is easy and requires commitment and perseverance. The task is made both easier and pleasant when the group consists of pleasant and respectful members, such as was the case with us. In my case, this will leave quite indelible and endearing memories, as has been the case with other organisations and groups I have been associated with in the past. However, Colette, Emma and Lisa must be commended for the commitment and effort they have afforded to this MyComrade study and the help and leadership they have extended to us to be able to make our contributions. We look forward to being involved further as the study progresses. Now I hand back to yourself, Colette.
Okay, just a thank you for all in all.